Okay, so in this little talk, we're going to talk about the intrinsic conduction system within the heart, or what we call in class the cardiac conduction system. Now, again, we're not gonna go over this like a lecture we did in class. Just hit the high points of this. Now, remember that the heart itself, the cardiac muscle, has what we call an autorhythmicity. That the action potentials are myogenic. Basically, what we're saying with those terms is that the heart has its own inherent rate and rhythm. The heart paces itself, it makes itself beat. I remember that the influence that the brain has on the heart is to speed up or slow down heart rate, or to weaken or strengthen the force of cardiac muscle contraction. Okay, but the heart itself beats on its own. All right, and it's able to do this because of this cardiac conduction system, or as your book calls it, the intrinsic conduction system. All right. Now remember that when you look at this conduction system, what it is basically it's a specialized. Don't think of this as just actual organs within the organ itself. Think of it as just a bunch of kind of organized clusters of cells embedded in certain areas of the myocardium itself. It's kind of like its own. It's kind of like a nervous system within the heart itself, except it depolarizes and repolarizes at its own inherent rate. All right, um, so basically, you have one bundle of cells up here in the right atrium, in the sinus of the right atrium, and we call that the SA node or sinoatrial node. You've got another kind of cluster of these autorhythmic cells, kind of almost within the atrial septum, called the atrioventricular node or the AV node for short. And then it forms this one branch called the bundle of His, which is named after the Swedish physician Wilhelm His, who originally discovered and described this in, I think, 1893, I want to say, so late 1800s, somewhere around there. And then the bundle of His will bifurcate to form the bundle branches, and as you can see, these bundle branches wrap around each ventricle, so the one going around the right ventricle is the right bundle branch, and the one around the left ventricle is the left bundle branch. All right, and then you can see these little offshoots of these bundle branches called Purkinje fibers. Okay, and these Purkinje fibers directly innervate the myocardium in the ventricles and in the interventricular septum. And what I don't have shown on here is that these Purkinje fibers also branch up towards the papillary muscles in each ventricle as well to stimulate them to contract during the appropriate times. All right. So now I just described these in order of basically how this system works. All right. Now remember that basically when we talked in class, we said that these autorhythmic cells, they kind of have their own their intrinsic rates of depolarization, repolarization. They depolarize and then they repolarize. They depolarize and then they repolarize. They're always doing this as long as you're alive. All right. Now the question you should be asking yourself then is if all these bundles of autorhythmic cells, if they all depolarize on their own, how does the heart actually beat in a systematic fashion? Because you know that all four chambers don't contract at the same time. While the atria are relaxing or in diastole, the ventricles are in systole and contracting. So the question you should be asking yourself then is, how is there an actual order to this? And remember what we discussed the concept of overdrive suppression. Okay, overdrive suppression. Okay, now basically what we're saying here by this is that whichever one of these structures depolarizes the fastest, okay, whichever one of these clusters of autorhythmic cells has the highest inherent rate of depolarization, the rest have to fall in line with it. Because remember when we talked about the cardiac syncytium, the cardiac muscle, how it's all joined together, that basically when one area of the heart depolarizes, the rest of it's going to go because of basically the joining nature of the autorhythmic cells in the cardiac muscle tissue. All right, so then the question is, which part of this system is depolarizing at the fastest rate and making everything else fall in line? All right, and if you guide your attention over to the left side of the heart here, you can see I kind of have listed the structures of the conduction system and the rates at which they depolarize. All right. Now, first we have the SA node, the sinoatrial node. All right. The SA node on its own has its own inherent rhythmicity of about 100 to 110 beats per minute. Okay. So what we're saying here is that if we just leave this cluster of autorhythmic cells to its own devices, it will depolarize about 100 to 110 times per minute. Okay. Now that's pretty fast. Now, you know, though, that normal resting heart rate is give or take around 60 to 80 beats per minute. So what we're saying here is resting heart rate is much slower than the SA node's normal rate of rhythmicity. And the reason why is because of the vagus nerve. Remember we discussed this, vagal tone. The influence of the vagus nerve slows down the actions of the cardiac conduction system, and because of the influence of the vagus nerve, that causes the SA node to only depolarize at a rate of about, we'll just say for the sake of discussion, 70 beats per minute. Okay, 70 beats per minute. Okay, so then if we work our way down to the next structure, number 2 on here, the AV node, you can see that this depolarizes at a rate of 50 beats per minute. So these cells depolarize a little more slowly than the SA node. And then if we work our way down to the bundle of His and the bundle branches, I'm just kind of lumping these together for the sake of discussion. We'll say that these depolarize at a rate of 25 beats per minute, and then the Purkinje fibers at a rate of about 15. All right, so just by looking at the numbers, you can see that the SA node has the highest inherent rhythmicity. The SA node depolarizes the fastest. Okay, so as a result, the SA node is going to be setting the pace for the heart. All right, so because this is depolarizing the quickest, all the other connected cells and structures within the heart have to follow, have to depolarize at this rate as well. That's why we call this overdrive suppression. Even though all the other structures have their own inherent, rate of depolarization and rhythmicity, they all have to fall in line with the SA node because this is sending out action potentials the quickest. All right. So basically, we would call the SA node the pacemaker of the heart. That's its nickname, the pacemaker of the heart. All right. The SA node is the pacemaker. All right. Now let's kind of look at this in order on the heart of kind of how this works. All right. So basically, the autorhythmic cells of the SA node, they fire first. Okay. These depolarize the fastest, and then as you can see, these kind of dashed lines. So what happens next is when these cells depolarize, that'll cause the adjacent cardiac muscle cells to depolarize, and then that wave of depolarization will be propagated or transferred all throughout the muscle tissue that lines the atria. All right, and at some point in time, eventually, as you can see the dashed lines and the arrows, the action potential will reach the AV node. Okay, that action potential will reach the AV node, and then that will stimulate the AV node to depolarize, and then send that action potential down the bundle of His. And then as it bifurcates, that action potential will continue to travel down each individual bundle branch and eventually into the Purkinje fibers, making the ventricles contract. All right, and that's how this conduction system works. Again, it's just a system of clusters of these autorhythmic cells, these cells that have their own inherent rhythmicity, and they depolarize at certain rates. And again, you have the rates written up there. And then like I said, the SA node depolarizes the fastest, so the rest of the conduction system has to fall in line. Okay. Now, let's say someone kind of had a bad day and their SA node failed on them, then what would take over? What would pace the heart from here? The question you should be asking yourself is, what part of the conduction system depolarizes the fastest? And if you said the AV node, you're correct, because the AV node depolarizes at a rate of 50 beats per minute, and then the bundle His and bundle branch is 25, Purkinje fibers 15. Okay, so if the SA node fails, now the AV node takes over, except the heart now is going to beat at a slower rate. Okay, now it's important that we maintain this resting heart rate of about 70 to 80 to even 65, depending on how in shape you are, beats per minute. Again, a lot of this depends on your physical fitness, but it's important that, I mean, we keep this around this normal resting heart rate of 70 because this allows us, this is just enough time for the ventricles to fill with blood and yet still having it, and it gives the heart enough time to beat enough times per minute to circulate that blood throughout the body. Okay, what'll happen if we start losing parts of this conduction system and the slower pacing, parts of the system take over, then the heart will have enough time to fill, but then it won't have enough time to pump. There'll be too high of a volume of blood left in the heart, and there won't be enough blood out in the circulation, and then that'll make you start to lose consciousness. And as you know, that's not conducive to life. Okay, so it's important that the SA node, the pacemaker, is making the heart operate at this rate. All right. So again, that's just a brief review of the cardiac conduction system. The AV node, the SA node, AV node, bundle branches, Purkinje fibers, and then you have all the events of the cardiac cycle taking place once we run through this whole system, and then it starts over again. All right. And as you can see, this action potential travels from an area in a direction from right to left because of how the heart sits. Right.